Hi everybody, my name is Rhys Barber. I'm the audiologist here at Audiology Associates. We upload new earwax removal videos every Monday, Wednesday and Friday at 9 PM UK time, so please consider subscribing. Hi everybody, this is Rhys Barber from Audiology Associates. Thank you very much for watching our video today. Quite an interesting compilation, this one. We had 2 patients through in the last week with false fundus. So we thought it would be a really good idea to pop this compilation on just to give you an idea of what we see. So this first patient's come through feeling quite blocked up, obviously on both sides. There is a history of ear, nose and throat with severe ear infections in the past, which has left this patient with this collection of skin tissue here. Now, this skin tissue has actually formed a blockage in the canal. So this isn't the eardrum you're looking at here. This is almost like a false eardrum, almost like a second eardrum sitting just inside the ear canal. But this is a collection of like granular tissue, basically, that's blocked up this canal itself, which is going to cause problems with the sound being passed through to the inner part of the ear. So sometimes patients will have these removed, but if they're non-problematic and already causing too many issues, then patients will choose to just leave them there. And it could be that there's more problems by the surgery actually going in to fix the problem. They may cause more problems by going in to fix it. So this is the same patient now with the second ear. So what we can see here is very blocked up ear canal. We're just getting a grip on this dry skin layer here at the front end. You can see almost like a little sleeve of skin has formed around this wax blockage here. So we're just going to choose to take this away now. We're just going to choose that little center section there to get a grip on. See if we can pull this wax through that little sleeve of skin. There we are. You can see just wiggling it out of the canal there. Just very slowly working this out. There we go. You can see that little sleeve of skin at the base there, a little bit of dry wax above it. So we'll try and get a grip on that dry wax. The skin is flicking up though to meet the suction, so we're just going to move it out of the way. There we go. Starting to come away nicely there. You can see we've got a little deeper section in there. Let's get rid of that. We've got this fold of skin here at the bottom, which keeps flicking up from the base of the canal wall, but we've got this hard section here in the middle. So I'm just going to put the fine end on to stop the skin from flicking up in front of the suction so I can get a grip on this central section. Now at first glance this looks man-made, but it's actually a ring of skin that surrounded a hard core of wax. So as a little point on the back of it, at first glance I thought this may have been part of a hearing aid, but it's actually skin tissue, and there you can see that little folds. It's like a little flat disc, so skin tissue with wax in the center. So now I'm going to get rid of this bottom section of skin here, and this little flappy bit here as well. Let's get rid of that. Now you will see a lot of scarring in this ear. This lady, you can see the very thickened skin there on the eardrum from repeated infections. So this is what we removed. You can see that last little disc is what's to the furthest right hand side there, and you can see it there in inches. Now the next patient you're about to see, if you haven't already watched episode 94, that was this patient's original visit, which went back a little while. I'd highly recommend going back and looking at that before you look at this video. This patient's come through. We saw them, it must be about 18 months ago now, I think, where we took a lot of wax, a lot of dead skin away, and actually revealed a false fundus, which the patient didn't realize they had. So what we're going to do first of all is, this is the ear that we removed a lot of dead skin debris from last time. So we're just going to get a grip on this and take this away. Just slowly working this out here, just getting a good grip. The problem with these kind of skin issues, and because we've seen this patient before, we kind of know what's happened in here in the past with this kind of very dried up hard skin. So I'm going to elect to go straight in with the crocodile forceps here. Just getting a good grip on this to take this away. Thank you to everyone who checked out the merch site and has already placed orders. There was loads of orders. Thank you so much, everybody, for embracing that. Mrs. B was so pleased. She really didn't know whether it was going to go down well, but you were so lovely, as you always are. So thank you so much for that. You can see that we've got this really dry bit of skin now, so we're just going to grab that with a forceps. There you go. You can see it's lifting it out, wiggling this out of the canal. There we go. Let's have a good look behind that. You can see some scarring on this eardrum as well. Lots of really ripply and indentations all over the drum. A little bit of scar tissue there. So this is the side that we discovered the false fundus on last time. Got a bit of wax here at the entrance, false fundus sitting behind. So we'll just tidy this up for the gentleman today. He did say after the last visit we recommended he goes to see the doctor and ear, nose and throat consultant. He did go along, and it was felt that it would be more problematic to remove it than to leave it where it was, as it wasn't causing the patient too much of an issue. If you remember, the patient didn't actually realise they had it when they arrived in clinic. So they're just going to monitor it and just keep an eye on it. So he's just come in for a bit of a clean out today on this side. The first time we've seen him actually since that, so not a tremendous amount has built up in that time. You can see that we have a very thick, sticky wax all stuck to the base of the canal wall here. So we're just going to lift it off the canal wall first of all. You can see just trying to peel it away. It's really stuck there. There we go. You can see the skin starting to lift underneath as well. Really jammed on there. So loosening as much as I can. Got a nice good edge now to work on with the crocodile forceps. So we can get underneath that now. Just slowly pulling that away. You can see the skin kind of puckering up underneath that dry bit of skin there. Let's get a good grip on this and take it away. There we are. Let's take a look behind that. Now we can start to see that false fundus. See the blank end in the canal there. That's sitting probably about a third of the way down, but to sort of a third and a half. You can see it's really, there's no, the reason we know this is a false fundus and not the eardrum, first of all, it's not where we expect an eardrum to be. Secondly, we're missing the features. We can't see the hammer bone. There's no light reflex. The skin looks very different, looks thick, it's not translucent. So all these things would indicate to me that this is a false fundus. Just getting a grip on this outer section here. So our job today is to tidy this away. If you touched on that, you'd see there was a little bit of flexibility to that skin, but it is very, very thick. There will be some blood supply to that as well. So we're just going to very gently clear all this away. Patient remembers having a head injury when they were younger, but no other kind of factors really. A couple of infections, but not many. So we're just going to clear this away now. Just a little bit of sticky, dry material to the left-hand side. You can see how unusual that false fundus looks. Take a look back over. It's certainly not a nice shiny eardrum. So take a look back over a lot of our videos. You'll see the anatomical features we look for with the eardrums, and this just hasn't got any of those. Just slowly peeling this away. We've got a lifted edge on that one now, so we can get in here with the crocodile forceps. We're going to grip that little dry piece there. Just get a grip on the edge, see if we can line the forceps up. There we go, and start to peel. There we are, it's coming away. Oh, just broke away on the end. So we'll just go and peel that little section away there. Got a nice good lift on that now, so we should be able to get a deep grip with the forceps. There we go. And off that bit comes. There's one last dry section to the base of the canal there. It's quite flat, so crocodile forceps are not going to get underneath that. So we're going to aim with the suction, aim just slightly above, bring it to the suction. There you go. And then we can peel that away. Lovely. Let's have a good look at this false fundus now. You can see what I mean. The skin just looks beige in colour. It's not translucent. So this is what we removed. So to the left hand side, that's the piece we removed from the first ear. To the right is what we removed from the side with the false fundus. Thank you very much for watching our video today. If you did enjoy the video, then please like. If you're not subscribed already or you'd like to do so, you can click the subscribe button here. If you'd like to check out some more of our videos, they're also up there. Now, if you want to follow us, you can do on Facebook, Twitter, Instagram, and also check our website if you want to know a little bit more about us. As always, guys, until the next time, take care.